a medical scientist with over 15 years of experience, including Cleveland Clinic, Abu Dhabi, correct? Shilpa blends science, Reiki, functional medicine, and mind-body practices to support resilience and healing. Welcome on stage, please. May I get a round of applause? Feel good energy.
Thank you so much. Yes. Thank you so much, my gorgeous girl, for the warm and wonderful introduction. Hello, everyone. How are you all feeling today? God, I'm so glad. Thank you for sharing your feelings. Today, I'll move out of your way. Today I'm going to talk about integrating lifestyle interventions and holistic healing in cancer care, how it helps enhance cancer patients' well-being. I'm going to talk to you about my observations and experiences as a functional medicine health coach and as a Reiki master practitioner. So I would request you all to come with an open mind and an open heart. I'm going to skip through those two slides and I'm going to come straight to holistic healing part. So I'm going to take you through 3 foundational pillars today: nutrition, movement, and stress management. The holistic healing component comes under stress management. I'm going to start with stress management first, and then I'm going to take you back to nutrition and movement. There is a reason behind it. I'm going to take you on a journey. During my tenure at Cleveland Clinic Abu Dhabi Hospital, I also took care of cancer patients as a health coach and a Reiki practitioner. So when patients were referred to me, I went and saw them, again, as a health coach and a practitioner, but my approach was different. I just couldn't go in the room, pull up a chair and say, okay, let's talk about your nutrition and movement. They would look at me and say, I'm sorry, who are you? And what do you mean by nutrition, movement, health coaching, functional medicine? Like, no, please leave. So the approach has to be different, because when they get diagnosed with cancer, I can only imagine what they're going through. I can only imagine what the families are going through. There's so many myriad of emotions there that you have to respect their state at the time, the family's state at that time, the faith and the belief, because we're in a very dynamic culture. So you first essentially have to build rapport, build that connection, build that bond. Establish that trust, that credibility. And when they feel safe and comfortable with you, then you go in, take the permission, sit down, and start talking to them about who you are and what you do. So essentially, what I used to do was I used to go in the room and I used to ask my patients, how are you feeling today? And they used to open up, and this whole myriad of emotions used to come out. The release that they achieved because of that was much needed. And what did I do as a practitioner and a health coach? Simply listen. Give them the attention that they need. Focus. Simply listen. With non-judgmental curiosity, actively, simply listen. Give them that space. And once you have established that connection, that trust, then I used to focus on the emotional and mental well-being. Because if the mindset is not there, because you need to actually have a very strong, a very flexible mind state when you go through this journey. So if they're not in the frame of mind to talk about nutrition and movement, because they're all over the place, because the emotions are all over the place, you have to work on the emotional and mental well-being. And how did I do that? With Reiki. So what is Reiki? Simply means universal life force energy. It's a Japanese restorative technique that is safe, simple, natural, spiritual in nature, does no harm, has no religious beliefs or dogma, so everyone can use it. It falls under the realm of complementary and integrative medicine. It's one of the biofield therapies. Now, what do I mean by that? Each of us have energy fields surrounding us. So as per literature, it's the interaction between my energy field and my client's or patient's energy field is one possible way Reiki could work. Now, it involves me as a practitioner simply gently touching my patient or my client. There's no pressure, massage, or manipulation. So I channel the energy that is surrounding me, through me, into my client or my patient from my hands. What happens is the energy that is surrounding them will freely flow through the inner meridians and channels, clearing away any blockages that may be present. And I'm talking about emotional and mental blockages. What's the outcome of that? They feel. So the intention of this practice is to create deep relaxation, so they feel deeply relaxed. reduce anxiety, stress, pain, nausea, restore your balance, enhance your well-being. What does research say about Reiki? It reduces fatigue and increases the quality of life of breast cancer patients receiving chemotherapy. It helps in reducing anxiety, depression, and stress symptoms. It has positive effect on pain management and stress reduction. It significantly enhances quality of life, and I've seen this with my patients. When I give my patients a Reiki session, I usually ask them after the session, how are you feeling after receiving a session? And they usually come letting me know, I feel happy, I feel joy, I feel relaxed, I feel lighter, I feel calmer, my stress has gone down, my pain in my muscles or my headache has lessened. Sometimes they feel heavy, sometimes they feel tingling sensation, but as the day goes by, they feel lighter and they feel better. Now that's the anecdotal evidence, because their perceptions of feelings are true, raw, and real. Now Reiki is intangible, falls in the realm of quantum physics. So how do we give it validity? So I used a numerical validated tool called Edmonton Symptom Assessment System Revised Scale, which has been used in major cancer institutes around the world, including MD Anderson. And I focused on 4 major symptoms: pain, stress, anxiety, overall well-being. And I requested my patients to score how they felt before the session and after the session for those 4 symptoms. So 0 means best possible feeling. I feel fantastic. 10 means worst possible feeling. And of course, when they're newly diagnosed and when I come in as a practitioner and start giving them Reiki session, most of the time, pain and anxiety and stress are usually on a scale of 8 to 10. They feel terrible. After the first session, it usually goes down to 4 or 5, so you've got about 50 to 60% reduction just after first session. I usually follow my patients all throughout the journey, through chemo, through radiation if they need that, pre-post surgery, immunotherapy, or targeted therapy if they need that, depending upon the prognosis, and post-surveillance, or when they're in remission. And what I observed throughout the series of treatments, it showed cumulative effect, additive effect. So in the second session, when I saw them, their anxiety, stress, pain levels were already a little low, and they got even lower after the session. So you could see this trend of stress, pain, anxiety going down, and your overall well-being going up. It enhances. I'm very grateful and very, very happy to announce that Research and Ethics Committee have approved my study for publication. So I will be publishing my study soon on a role of Reiki in symptom management in cancer patient, inshallah. I'll share it with you all soon. Now, sometimes I also include sound healing as a part of patient treatment or care. Now, I can either do sound healing separately or in combination with Reiki, whatever the patient's needs are at that time, because my main focus is my patient's needs, what they need at that moment, at that day, because their comfort, their health, and well-being is my priority. What is sound healing? It works on the principle of intention, vibration, and voice. Your voice is the most powerful tool. The vibration it emits, the frequencies it produces is potent. And mix that with intention. It sends a powerful message across your body. Because if your intention are, I'm healing, I feel fantastic, I can do this, I can get through this journey, your cells are going to receive that intention with that vibration and frequency, and they're going to reciprocate. So what your mind believes, your body will achieve. Vibration, I use different instruments: Tibetan bowls, gong, crystal chalices, crystal bowls, tinctures, ocean drums. They all correspond to your different or in a specific energy locations. I'm talking about chakras. So from root to your crown. And they emit vibrations, resonate at different frequencies. So what's exactly happening? Why do patients feel relaxed, calm, stress-free, or sometimes energetic? Why is that? Because these different instruments that emit various frequencies, it alters your brain waves. So I'm talking about from beta brain waves to more relaxed theta and delta brain waves. And this was actually captured in one of literature via EEG, electroechocardiogram, where the author could actually see the altered states. So what does research say about sound healing? It relieves stress, anxiety, and depression. There's pain relief and relaxation, relieves insomnia and headaches, increases productivity and focus, releases emotional and energetic trauma and blockages, boosts your immune system, and increases mental and emotional clarity. Along with this, I also used to add breath work. Breath is catalyst to longevity and vitality. I'm talking about health span and lifespan. Breathing comes to us naturally. It's an autonomic response, but conscious breathing is where magic happens. And conscious breathing could be in form of box breathing, resonant or coherent breathing, 4-7-8 breathing. You've got your Kalpabhati, pranayamic breathing, belly breathing, thoracic breathing, diaphragmatic breathing. So what's exactly happening when you breathe consciously? You've got nervous system regulation, stress response, oxygenation and detoxification pathways are activated, brain and immune function absolutely enhances and improves. What does the research say about breath work? Cancer chemotherapy-associated symptoms and quality of life are improved. Sleep disturbance reduced. Anxiety reduced. Mental quality of life is improved. So when I see my patients, I include stress management techniques first, because that's my approach, because we need to get them at a level where the nervous system is regulated. So take care of the emotional and mental well-being first. So scientifically speaking, what is happening here? These energy healing modalities regulate our nervous system. I'm talking about emotional regulation. So you respond to stress rather than react. Your vagal tone is enhanced. It activates your parasympathetic nervous system, so your entire body is flooded with feel-good hormones. I'm talking about dopamine, oxytocin, serotonin, endorphins, melatonin. Cortisol levels go down. Oxidative stress decreases, so it helps with your metabolic function. What happens because of that? Your immune system gets a chance to recover. Your body's natural innate ability to heal itself kicks in. And when my patients reach this stage, now remember Dr. Arpit spoke about flow states, blue mind and red mind. They're in purple mind at this moment. What does that mean? They're focused, they're alert, but they're calm and coherent at the same time, so they can make informed choices and decisions. And this is where I then wear my functional medicine health coach hat, and I talk to them about nutrition. Everyone over here knows about nutrition. Food is information. Food is medicine. Has anyone of you heard the term eat the rainbow? Yes? Everyone's nodding, so you all know, you're all experts in that. This is where I sit with my patients, and this is where we have a discussion about nutrition. Eating nutrient-dense food, eating food that helps with your gut microbiome, because gut microbiome is the boss of everything in your system. It just controls everything. We talk about where the food comes from. The ingredients are important. Where it originates from. It's got to be organic. If it's not organic, how do you wash them, keep and clean, maintain them? Because you want to make sure there's no heavy metals or pesticides on the food. You want to make sure that the food that you're getting, if it's organic, where does it come from? What sort of farming practices we use that it comes from? Did it come from regenerative farming? Did it come from, hydroponics? Is it locally sourced? Is it sourced from overseas? Does it come from a soil where the grazers have, kicked over the top soil? So the food that comes out is extremely nutrient rich. We talk about eating grass-fed meat, poultry, where animals are grazing around in beautiful sunshine, fresh air, and eating this nutrient-rich grass because the soil is extremely nutrient-rich and dense. What does nutrition say? What does research say about nutrition? You just know what it says about nutrition because it's how it makes you feel, provides sufficient energy, maintains strength, enhances immune function and recovery, preserves muscle mass. This is important because during chemotherapy, patients tend to lose a lot of muscle mass. They tend to lose their appetite. Sometimes they tend to lose the sense of taste and smell, so they just eat what they feel is going to provide them with most nutrition and energy at the time of their chemotherapy or the journey. Improves response to treatment, helps manage system and enhances well-being. We then move on to movement. Movement is life. Dr. Ellie and Simlan spoke about this. There is no shortcut to VO2 max. I believe what they say, and I'm a full proponent of VO2 max being one of the biomarkers of longevity. So I'm talking about health span and lifespan. Of course, with cancer patients, they're not going to directly jump into HIIT training or dance fitness while they're going through infusion, but they need to keep moving. They need to keep moving. Hydration is important, movement is important, because you're going to pee the toxins out, you're going to sweat the toxins out, you're going to poop the toxins out. So you need to keep moving. And movement could be as simple as taking a walk around your house. If your body cannot support you, going outside, walking barefoot on grass or in beach water or on sand, walk around your house. But listen to your body. Your body's a wonderland. It absolutely knows what to do and how to heal itself. So when you're going through your chemo journey, still keep on moving. And as you finish your journey, this is when my patients actually then say, okay, I've incorporated yoga and Pilates for balance, for stability, for mobility. I've included strength training to improve my muscle mass, so percent body fats goes down, and to improve my bone density, because they need that. Remember, these girls are going through so much medications, and if side effects of chemotherapy is horrendous. And then if it's hormonal related cancer, they get given medications that brings them to menopause straight away. And that is, I mean, I can only imagine what they're going to. I can only imagine. So these interventions, when you stack them at the beginning of their journey, really, really helps them in managing their symptoms properly. Remember, holistic techniques are complementary, are integrative, but they do help. They're very impactful, and they have positive benefits on the outcome of cancer patients' journey in terms of how they can effectively manage their symptoms. So with that, I want to take you through a story. Please meet my warrior saint, Lisa. She was diagnosed with stage 4 metastatic breast cancer. The cancer had spread to her liver, so she had lesions in her liver. When I first saw her upon initial diagnosis, I saw her as a practitioner, and then after we finished a Reiki session, we started talking about functional medicine. And I told her that I was a health coach, and then we got straight into nutrition, movement, intermittent fasting, sleep, all the foundational pillars of functional medicine. We discussed books, Cancer Revolution, Eat to Beat Disease, the Walls Warrior Protocol by Dr. Terry Walls. And she said to me, Shilpa, I am going to incorporate some of these interventions whilst I'm going on chemo. She didn't tell her oncology physician because they were like, don't you dare interfere with my protocol. Don't do this. You can eat anything you want. Don't fast. You don't have to exercise. I'm like, whoa, stop. These interventions are going to help. But she said, I'm not going to tell my oncologist. I'm like, girl, I'm going to leave that decision with you, but I respect that. She used to fast 24 hours before her infusion. She obviously had water with electrolytes or green tea, herbal teas. Then she came to the infusion. She had her infusion. She did not suffer any major side effects. She broke her fast by eating nutrient-dense, microbiome-rich foods, so fermented foods, right? Fermented vegetables, pickles. She broke a fast with that, with bone broth or clear broth or chicken broth, and then she incorporated nutrient-dense foods. She had fish in form of protein, eggs, of course. She didn't have any red meat at that time, so she still had a little bit of muscle mass depletion and reduction. However, she continued this through her chemo journey, and on 8 weeks, her oncology physician said, let's go do a PET scan again and see what's going on. PET scan, done. Lesions in the liver, gone. Completely gone. We had a session that day, and she was ecstatic. She said, it worked. I'm going to keep doing this. And while she was going through this journey, she worked out. I mean, not just moving, she was on treadmill, she was walking, she was doing light weights. She's like, I am not letting cancer take control of my life. I'm going to push through, I'm going to get this done. Of course, what also helped was she had a lot of faith, a lot of belief. She did prayer, she did grounding, and that works as well. Truly, it works. And after that, essentially, her oncology physician stopped. She was supposed to do 12 cycles. He stopped at 8. And he said, well, yeah, that's it. You don't need any more chemotherapy. Off you go. And she's like, well, let me ask you a question. Did you give me like half the dose of medications? He's like, no, why are you asking that? Didn't you suffer any major side effects? She's like, no. He's like, oh, okay. He thought, great. But still, at that point, she didn't tell him that she was going through this journey besides the conventional medicine. So what's the whole point? What am I talking about? Why am I talking to you about all of this? Please, we need to include these interventions with conventional medicine. Stack these interventions with conventional medicine. Work with an integrative oncologist, a functional medicine practitioner, a functional medicine health coach, a holistic practitioner. It's a multimodal, multidisciplinary approach. It's just not, here is your chemotherapy treatment protocol. Do this and, yeah, go see that person. Go see that person. Yalla, khalas, I'm done. It's not that easy and it's not that simple. We need to support our patients. It has to be multidisciplinary. And these interventions have to form a part of patient's treatment, protocol, or plan of care. It is a must, and we need to push this through. So Lisa is all good now. She just ran 10 kilometers to mark her no evidence of active disease, and that too, she ran in Disneyland. So there you go. Wonderful. I really want to express my heartfelt gratitude to my beautiful patients and their families, because without their belief in me and faith in my practice, I would have never been able to, sit with them, listen to them, take care of them. So I'm eternally grateful to them for allowing me to be a part of their journey, and I still am. I've also formed a support group called Tribe of Warrior Women, Spirited, Thriving, Conquering Support Group, because there's a huge gap where I'm in Abu Dhabi. There's not a lot of support groups, and community is one of the foundational pillars of functional medicine, and it helps. It really helps with the journey. These are my references. I would like to take you all through a 5-minute guided resonant breathwork practice. Would you guys like to do that? Yes. Okay. Can we please put the music on? Thank you so much. Sit yourself comfortably in your chair. Raise your spine tall and strong. Ground your feet on the floor, palms facing down. When you feel safe to do so, close your eyes. Soften your shoulders. Unclench your jaw. Feel your muscles relax. Let everything go. Take a deep breath in through your nose and let it all out of your mouth. Take a deep breath in through your nose and let it all out of your mouth. Once more, take a deep breath in through your nose and let it all out of your mouth. Continue breathing gently to whatever feels good and organic for you. Inhale love, exhale kindness. Inhale at 4, 3, 2, 1. for 4, 3, 2, 1. And exhale for 6, 5, 4, 3, 2, 1. Continue breathing gently. Inhale gratitude. Exhale calm. Inhale for 5, 4, 3, 2, 1. And exhale for 5, 4, 3, 2, 1. For the last time, inhale for 5, 4, 3, 2, 1. And exhale for 5, 4, 3, 2, 1. Take a moment. Bask yourself in this serenity, in this tranquility. Imagine how it makes you feel. Do you feel calm? Do you feel happiness? A sense of joy? Some peace? Abundance of love? Continue breathing gently. Do whatever feels good and organic for you. Whatever comes naturally to you. Take a moment. Continue breathing. Simply observe. Simply be. And whenever you're ready, you may now wish to move your feet, your legs, your body, your hands, your arms, your neck, and your head. Take a moment. Give yourself a bit of gratitude for being here today and looking after your well-being. And when you wish to do so, you may now choose to open your eyes. Thank you very much, everyone. How do you all feel? Tell me in one word, how do you all feel? Pardon? Nice, great. Well, that's what we are trying to achieve. There you go. Mission accomplished. Thank you so much, everyone. I'm truly grateful for you for giving me the space to share my passion, my purpose, my ikigai. You can find me on LinkedIn under Shilpa Kudekar McNeely or on Instagram as Kudekar Shilpa. Thank you so, so much.